Cook County Commissioner Scott Britton. February is American Heart Month, a time to spotlight heart disease, which is the #1 killer of Americans. Today, I am joined virtually by Marla Cowan, a longtime Glenview resident and heart health advocate. Marla underwent a triple bypass surgery at North Shore University Health System, where she continues to receive outstanding care. Marla has taken her firsthand experiences with heart disease and deftly navigated life with a new focus on heart wellness. This included joining Keep the Beat Wellness of Northbrook and becoming an active member of WomenHeart, the National Coalition for Women with Heart Disease. As WomenHeart champion, Marla channels her passion and knowledge for heart health as a teacher and speaker. She inspires thousands of women along the way. Marla, thank you so much for joining me here today.
It's my pleasure. Thank you for the opportunity.
So WomenHeart sounds like a fantastic organization. Can you tell the folks here in the 14th District a little bit more about it and how you became involved?
Oh, of course. In 1999, 3 women were misdiagnosed, undertreated for heart disease. They had all undergone surgeries of one sort or another. And they decided they did not want another woman to have to endure what they endured. And so thus was born WomenHeart, from the beginning of 3 women needing treatment for heart disease. And at the time, there were no support groups for women, so the aftercare was not available. Doctors would heal them, and then they were left on their own to recuperate. And my connection to WomenHeart began right after my bypass surgery. I asked the doctors, where can I go for emotional support? You healed my heart. What do I do for the rest of me? I have the rest of my life, and I'm not functioning highly the way I used to. I found WomenHeart quite by accident. It wasn't advertised. And so women, like-minded women, were on the same journey. And I got the support, the emotional support that I needed at just the moment that I needed it. I became so enamored of the group that I asked to be trained at Mayo Clinic so that I could do outreach, speaking, and use my teaching skills to reach more women, to save more lives, and to impress upon people that 1 in 3 is a staggering number. It's more than breast cancer. And so if you have a heart, you could have heart disease. And therefore it became my mission, personally and professionally, to seek out other women and to relieve their anxiety and to tell them what they could do to preserve their life. WomenHeart actually meets in 3 North Shore locations, and we meet at 3 hospitals, one of them Lake Forest, the other Condell, and then of course at Glenbrook. Presently, we are meeting virtually, and we hope to continue that in the future because it seems to work well, especially with this winter. So my volunteer work has been since 2006, and I'm still enjoying every moment. I've been grateful for this opportunity.
Well, that sounds great. I'm amazed that there wasn't a more direct support group before that period of time for women with heart disease, but it certainly sounds like it's filled an essential need throughout. Is it a national organization?
It is. We are located in Washington, D.C. We do advocacy for women's health issues, education, and support. Those are our 3 main missions. There are other groups out there, but they are mixed male and female. Women have different presentation, different needs, and so a woman's group allows for just a bit of a different edge on heart disease, because women are generally caretakers. When a man goes home with heart disease, his wife is there to care for him generally, or a daughter or a sister. But when women go home, they're expected to resume normal duties, and who is there to care for them unless you have a very nurturing husband, as I'm sure you are.
Thank you. Well, as we talk about the importance of realizing the real prevalence of heart disease throughout our country and how significant it is in our life, especially as we get older, can you just describe for us the signs and symptoms of heart disease in women and men, and what should be aware of where we would need to seek treatment?
Certainly. We already know that 1 in 3 women can be victimized by heart disease. We also know that with modern medicine, there is much to be done. I don't want to leave people with the impression that if you have it, that you cannot make it. I've been well since 2006, thanks to good medicine and good science, and of course, adequate care. But here are some of the important signs that women and men should look for. You'd be aware, of course, that women present differently, and so some of the symptoms might be more common among women than they are among men. Chest and upper body discomfort. I myself had abdominal pain, sweating, clammy, and these are all symptoms that can occur suddenly, onset with no resolution and immediate. In other words, if it doesn't go away in a short amount of time. Shortness of breath can indicate lung and heart issues. Nausea and vomiting without having the flu or some other illness. Being lightheaded. Pain in the jaw, the neck, and the upper shoulders. Very common among women, not so common among men. Men tend to present with chest pain, larger vessels, larger men, more blood volume. Pressure in the upper back or abdomen that persists. Palpitations or flutters, again, very common in women. Doesn't resolve, it needs to be checked. Unusual fatigue, where you cannot get out of bed. Some women have complained of malaise. They just simply cannot function. And very often inability to sleep. We know sleep is tied very importantly to heart disease. Lack of good, restful REM sleep can cause and be a significant part of heart disease. So those are some of the common symptoms. Some are more prevalent among women. So people need to know their own body.
So can you talk to us a little bit about some of the social determinants and risk factors that can lead to heart disease and that our viewers might want to be cognizant of?
Well, I think we know enough about heart disease and about income disparity to link those two together. That if you're living in certain zip codes, your accessibility to good health care is limited. If your income is limited, if you have obesity in your family, or if you yourself have a very large BMI, body mass index, you're putting more pressure on the heart to work harder. So people need to know their numbers and they need to have communication with their doctor. Diabetes affects the vascular system. Therefore, it also affects the circulatory, the heart. So having diabetes under control. Hypertension, very common among African Americans, and not having controlled hypertension can lead to stroke. That is a known factor. High cholesterol, I have it in the family. I have it. Unfortunately, I transmitted it to my children. And that is also a risk factor. You're developing plaque in your arteries. Autoimmune diseases, we've linked some of them to being precursors for heart disease. So you need to know if you have an autoimmune, it needs to be treated. We've also noticed that depression, long-term depression, can lead to heart disease. There's even something called a broken heart syndrome, Takotsubo, where women very often present with heart attack symptoms but are not having a heart attack from grief or stress. Smoking, I don't have to cover that. We all know better to eat a little chocolate than to smoke. Preterm delivery, and again, this applies strictly to women, so men can take heed. If your wife has preterm delivery, gestational diabetes, preeclampsia, those are all markers for future heart disease. So a woman needs to know these things when she is pregnant and care for herself. Trauma and grief, I think that goes along with depression as well. When women especially suffer trauma, rape, violence, seeing something that they should not, that stays with your body. It raises all the levels, that fight or flight response, that cortisol level goes up. Those very negative hormones affect your body and in such a way that you could possibly have long-term damage. So chemo and radiation, which I underwent radiation as a young woman, that also caused damage to my heart. Today, fortunately, with what we know, doctors usually do a baseline on anyone who's receiving it for lung or breast cancer. They know what your heart looks like before you get your treatments. They know what it should look like after. These are improvements that weren't available to me back in the 70s. So medicine has come a long way. One other thing, which of course is terrible to say in a pandemic, I don't know how you avoid stress, but you have to find some time for self-care. You have to lay down on the floor and do some deep breathing. You have to exercise as I do and keep the beat. You have to know your genetics. We have to reduce the things that we are already aware of that will cause heart disease, and stress, of course. Well, we're doing the best we can. This will pass too, as my grandmother would say.
Well, and I know reducing stress would be a huge part of trying to keep your heart healthy. Is there other things we can do and that we can communicate to our listeners as to how we can keep a healthy heart?
Absolutely. I'm going to make some suggestions. We all know about diet impacting. You are what you eat, as they said many years ago on TV. And the truth is, we overeat on certain animal fats. So if you can reduce even your intake of animal fats, let's just say reduce your butter intake, not give it up. You don't have to give it up. You can substitute olive oil. There are healthy oils. But eating meat 5 days a week, I think you could substitute one plant meal a week and your family would still be satisfied. I think diets where you oversalt your food, where you could be using spices as other cultures do, is certainly look up, what the good benefits of cumin and turmeric, and even Mrs. Dash, a salt substitute. A lot of our foods are salted anyway, so I find that it's disconcerting when someone just automatically adds salt. It puts you at risk for hypertension. Please, less processed foods. I know it's difficult in a pandemic, but if you can avoid the boxed foods and substitute any kind of vegetable, anything of any color, fill your plate with color, any fruit, any vegetable. And it's all been recommended by the Mayo Clinic for many, many years. Excuse me. And they do believe that diet does influence, it does impact. We all know about exercise. I find that if you can even walk in place, if you can't get out because it's dangerous weather, can you stand in place and walk a little bit up and down, march? Can you take some time for a Zoom class for exercise, as I do? And deep breathing every day. Just take a minute for yourself.
I've noticed that there have been some studies done recently about weight gain during the course of this past year. And the numbers have been startling as to the amount of weight apparently we've gained. And obviously that's something we should also try to maintain and not only eat healthy, but eat a little bit less processed foods, sugars, and that type to keep our weight under control. Does that make sense?
It does indeed, and I concur. Unfortunately, we're all sitting around watching Netflix and Zoom, and so eating comes naturally. It's a substitute. You can substitute fruits and vegetables for the chips. You can find other things to eat if you need to. And the one thing the doctor always told you, drink more fluids. I think people are quite dehydrated, and you can mistake that dehydration for hunger. So if you pick up a glass of water, mix it with a little fruit juice, if you're like me and you don't care for water that much, make yourself a cup of tea. I think more liquids could substitute. And of course, a little more activity if you can find it, if it's in your schedule.
That's great. So Marla, COVID-19 has been on the top of our collective minds for over a year now, with a lot of emphasis on the strain it puts on the respiratory system and the lungs. How is COVID-19 affecting those with heart disease?
Oh, I think we've heard from many doctors that it is an inflammatory disease. It affects the heart and the lungs. So if you are already at risk, let's say you have a family history, let's say you don't know if you have heart disease, but you know you have a family history, you are one that should consider taking the vaccine, provided you can get it. So when it's available to you, we know that it's an inflammatory disease. This is disease, a lot is unknown. You're best to follow the advice of medicine rather than, I hate to say this, but social media can be very misleading. It's not medical advice. I go to websites that are medically advised. I use Cleveland Clinic, Mayo Clinic, sites that we know are scientifically database driven, and I don't trust Facebook except for visiting with friends. So use sites that are giving you proper information. And yes, if you're at risk for heart disease or you actually have it, you need to get the shot. I was told by a doctor, you don't want this virus. Do whatever you can.
Absolutely, that's good. Well, Marla, I want to thank you for taking the time to talk with us today and to share your wealth of knowledge on these women's hearts issue The residents of the 14th District very much appreciate your time and your attention. If someone is interested in learning more or becoming involved with WomenHeart, where should they go?
Well, thank you for asking. WomenHeart is, we have a webpage, www.womenheart.org. They can visit, get information that's up to date, medically approved, and also they can find groups in their area. If they don't live in the North Shore, there are groups all over the United States and Canada. They just have to go to our website to find it, and they should be able to get in touch with me through the website.
That sounds great. We'll try to share that information on our social media and website as well. So Marla, I want to thank you for joining us today. I hope everyone who watched this was able to learn something about keeping your heart healthy, especially during these trying times. Thanks again, and be well.
Thank you.